Good evening, everyone. Thank you so much for being here with us. And as always, I hope you and your loved ones are safe and well. Tonight, we are here um, to do a town hall on Veterans Affairs and how we can best support the individuals and their families that have answered the call to protect our rights and serve our country. Our veterans are asked to put their lives on the line to make sure we are safe, and now it's our turn to make sure that they are cared for. Tonight, I am honored to be joined by my colleague, Representative Mark Takano from California's 41st District, who's also the chairman of the House's Committee on Veteran Affairs. We will discuss some legislation and topics that impact veterans most. Then, to end the event, we will have a Q&A where we will be joined by Neil Doyle, who is the Director of Veteran Services for Hennepin County. Now, I will invite Representative Takano to introduce himself. Chairman?
Well, thank you, Representative Omar. I am Mark Takano. I'm chairman of the Committee on Veterans Affairs from the House of Representatives. I represent the 41st District of California. And let me just say that we've been working very hard, just the entire Congress, to get results for veterans across the country and to hold the Veterans Administration accountable, especially during the COVID-19 pandemic. And that's why we've held VA accountable during the pandemic to ensure that they could both care for veterans, which is the first mission of the VA, and civilians under the fourth mission. Many people don't know that the VA has a fourth mission, which is to be the backup healthcare system when the civilian healthcare system is overwhelmed. And the VA does that during national emergencies. That's why we've also advocated for veterans in the HEROES Act to expand healthcare coverage, increase support for homeless veterans, suspend debt collections, as well as increase funding to ensure our most vulnerable veterans can get the care they need at home. Last summer, we finally passed the Blue Water Navy Vietnam Veterans Act, and we'll talk more about that during the course of the evening. We've also launched the Women Veterans Task Force and passed the Deborah Sampson Act. And all this effort is about ensuring that the increasing numbers of women veterans get access to their benefits. And finally, what I want to mention is we've passed 16 suicide prevention bills and introduced the Veterans Compact Act to support veterans in crises. And so with that, I want to turn it over back to Congresswoman Omar, and we'll be happy to take some questions.
Well, that's really great. Thank you so much for being here with us tonight. I know that our constituents oftentimes ask us, what's the work look like that's getting done on behalf of veterans in Congress? As you probably know, the care for veterans is very high on the list of priorities for many of our constituents. And I know that as the chair of the Veteran Affairs Committee, when you were running for that, you had some ideas in ways that you can incorporate advocacy in really bringing forth a lot of issues that were not being discussed on that committee. And so I know, as the chair of the Veteran Affairs Committee and as also the chair of the Equality Caucus, you've worked on a lot of things in regards to this administration and the ban that they have on trans soldiers. Can you tell us a little bit about that work?
Well, yes, I can. Ilhan, any person who has the courage and patriotism to serve a nation at war should receive our unwavering gratitude and support, regardless of their country of origin, regardless of their sexual orientation, and regardless of their gender identity. This summer, I helped secure an amendment in the National Defense Authorization Act that would require a joint report from the Secretaries of Defense and Veterans Affairs on former members of the armed services who were discharged under policies discriminating against LGBTQ service members and who also applied for a discharge upgrade. I've been working with Congressman Mark Pocan, who is the co-chair of the Progressive Caucus. And together, we've both been concerned, in addition to the trans service members that have been impacted by the anti-trans policies presently being imposed by this administration. We're also concerned about making right the unfair discharges previous to Don't Ask, Don't Tell. Prior to even Don't Ask, Don't Tell being implemented in the 1990s, we know that there were service members that were discharged because of who they were, and it wasn't always under a court martial. It wasn't always. There were various ways it could be done. I believe there needs to be a concerted effort to heal the hurt of loyal, patriotic Americans who were told that they couldn't serve America, or somehow their association with the service, the military services, would somehow be detrimental. So there's a lot of healing that we need to do for Americans who were systematically discriminated against in previous eras.
Well, thank you so much for that work. I know that you were a high school teacher for 20 years. And so I'm curious what grade you would have given Robert Wilkie as the Secretary of Veteran Services.
Well, let's say that there's a lot of room for improvement. And
So I'm hearing a C, maybe.
Well, let's say there's a lot of room for improvement, and that grade, anything below an A means you could improve, and there are several different grades that you could receive below an A. I mean, I wouldn't give the secretary an A, but I would say that where the VA could improve is very clear. They can improve in terms of how they've dealt with sexual harassment and assault, to updating the motto. They've been resistant on the VA motto, and removing Nazi headstones from VA cemeteries. I mean, they finally agreed to do it only after Debbie Wasserman Schultz, as chair of the subcommittee on appropriations that has oversight over the VA, or not oversight, but they have jurisdiction over the appropriations process, really grilled Secretary Wilkie over why there were headstones that honored and represented, in graphic form on the headstones, Nazi iconography. And the motto issue. The motto has to do with the motto that is inscribed in many of the VA facilities around the country, including our medical centers. It's a quote. It's a quotation from Abraham Lincoln's. I think it's his second. I don't know if it's second inaugural address, but there's a. He talked about for he who has served. For he who has served and his widow, as the purpose of the VA. Well, the word "he" no longer reflects what the VA does, and it already excludes up to 15 to 20% of our service members, the 2 million women veterans who are veterans now, but we know that we have 15 to 20% of our of our military service members being comprised of women. And we have the VA has really been resistant to the idea that we can update that motto without having to do any kind of disrespect to history or Lincoln's words. I think if Abraham Lincoln were alive today, he would definitely say we need to update that motto. He was such a believer in equality. And there's just been disappointment in regard to how he's dealt with sexual harassment and assault, and updating the training that needs to happen within the VA and change the culture in the VA. It is just unacceptable that women veterans cannot uniformly go to any VA medical center or any VA facility and feel unwelcome or uncomfortable or feel that they are going to be possibly harassed. Now, I want to mention one more thing I've been disappointed about. I've been particularly concerned about how the Trump administration has allowed his Mar-a-Lago cronies. Mar-a-Lago is his country club, in Florida. He's got a lot of rich cronies who have, inserted themselves into discussions and have advocated and have tried to go around and influence decisions by the Senate confirmed appointees. And sometimes they're not Senate confirmed. Sometimes they're just people who are actually in those positions of the VA. And one point of advocacy, was over a controversial PTSD medication, which is actually a derivative of ketamine. The president himself touted and promoted this medication, and people within the VA were being pressured to expedite its approval. We've seen this sort of behavior outside of the VA space with regard to, certain treatments for COVID-19. You might remember hydroxychloroquine being promoted. Well, that hydroxychloroquine was preceded by this fast tracking effort to approve PTSD drugs, which had there was inadequate studies and no real evidence that it would be effective in treating PTSD. So these are the crucial reasons why oversight of the VA is necessary and why we have to keep watching what it is they do. And so, as I said, Congresswoman, there's a lot of room for improvement.
Mm-hmm. I really appreciate that, and I wanted to have this conversation and to have you join us for it, because we often hold roundtables with our veterans and our facilitating discussions with them and trying to provide access for them in order to get services. And there seems to be some barriers sometimes to the services and to accessing the promise that was supposed to be made to them. And so I know that there are many issues that come up. Some of them are very serious, some of them are urgent, that are facing veterans. And I wonder, as the chair of Veteran Services, Veteran Affairs, how do you prioritize and create priority in what you will address with your committee?
Well, we look at, what our veterans are facing. And the priority just sort of showed up in my face in early 2019. We saw 3 veterans commit suicide at VA facilities within the space of 5 days. 3 veteran suicides took place. It grabbed my attention. It grabbed the attention of the administration, and for all of the efforts that we have made in the past couple of decades, almost, we've been engaged in one of the longest running military conflicts in our nation's history. 18 years since the invasion of Afghanistan and Iraq. There's obviously been some consequences for our veterans, but even prior to the post 9/11 generation, there's just an awful lot of veterans that haven't connected to mental health services, and so we've seen a persistent problem of 17 veterans a day committing suicide. Every day, 17 veterans commit suicide. And it's been a persistent, stubborn problem. And that persistent problem that we haven't made a significant dent in that number, and the succession of suicides that occurred in early 2019, actually on VA campuses, led me to declare this to be the #1 policy priority of the committee. And I set about assembling a staff with expertise in this area, convening roundtables and hearings. So to deal with why 17 veterans, National Guardsmen and women, and reservists die by suicide. It's just not acceptable. So that's why we worked on passing 16 veteran suicide prevention bills this Congress. It's why I introduced the Compact Act, which is a key piece of legislation which will address the angles, factors, and intersections that lead to suicide. The Compact Act is, I think, really significant. What it says is that for most veterans, 99% of the veterans out there, they can call the VA crisis line, which is open 24 hours a day, 7 days a week, and get evaluated. And if they're in crisis, under the Compact Act, it doesn't exist now, but under the Compact Act, the changes in the Compact Act, they can get emergent mental health care and not have to worry about getting a bill. I don't want to see veterans not calling the crisis line, not calling a VA, because they're worried that to do so will mean that they get socked with a big medical bill. My belief is, if you've worn the uniform in the United States of America, you deserve to get treated for an emergency mental health crisis, and not have to worry about not having to worry about having to pay for a bill that gets socked to you. So, Congressman, if you will, I'm going to give that crisis line number out right now.
Please do.
It's 1-800-273-8255. That's 1-800-273-8255. You should select option 1. So if you are a veteran or you know somebody, a family member or a friend that's going through a crisis, please have them call this number. Or you can also text 838-255. That's 838-255. Thank you for that, Congresswoman.
Yeah. And we will have it in the comment section on Facebook so that people can have that number. Thank you for that. And I know that there are, some issues that we have gotten the opportunity to work on together, because you and I both serve on the Education and Labor Committee, and so I wanted you to talk a little bit about the 90-10 loophole and why that's so important for us to fix it, and what barriers exist to having access to higher education for our veterans.
Well, thank you, Congressman Omar. Before I became a member of Congress, I was a high school teacher. And one of the things that really bothered me in the wake of the Great Recession was the aggressiveness of many for-profit colleges that are very predatory. They had billboards up in my district after so many people had lost their homes, and they were marketing to people who were desperate to retrain and to improve their skills. Often these schools, I would say most of the time, are of very low quality. They give out degrees and certificates which really don't have any value in the job market. And worse than that, if students want to transfer the credits they've earned at these schools, their accreditation is such that they can't transfer these credits. And so, these are very bad acting for-profit colleges. Well, the 90-10 rule has been around for a long time, but there is a tremendous loophole in the 90-10 regulation. What 90-10 means is that an institution of higher education can only take 90% of its funds, operating funds, from the federal government. It has to show that at least 10% of its funds come from students who are actually paying money for. There's actually a market value for the education and the programs they offer. Now, this is a minimal requirement. I mean, you think about public community colleges in your district, Congresswoman. Your typical community college is receiving way more than 10% of its money from other sources than the federal government. In fact, probably it's receiving only 10% of its funds from the federal government. The rest it's getting from student fees and taxpayer subventions from either the state or local tax base. You take a private school that's very credible. No way is that school receiving up to 90% of its funding from the federal government. So that's why we have a 90-10 rule. But what's the loophole we're talking about for for-profit schools? Well, it has to do with GI Bill, the GI Bill scholarship or the GI Bill benefit that our service members often get recruited into the military for. That's what a lot of our students, besides being patriotic Americans, they want to serve their country. They're also looking to get a very generous, our most generous higher education benefit. It can be worth up to $18,000 a year or more, and that's not even including the basic housing allowance. So they get housing and tuition. That's like having a target on your back if you're a veteran. If you're a for-profit school, you want to recruit those veterans because that's a lot of money. And you know why it's even more of an incentive for them to target and recruit veterans? It's because that $18,000 does not count against that 90% limitation. It counts toward the 10%. And so here's something that's really perverse. Every veteran who enrolls in one of these for-profit schools their GI Bill benefit does not count on the limit, the 90% limit of federal funds. It gets counted towards the 10%. And guess what? That school now has increased capacity to go and recruit low-income non-veteran students who are on Pell Grants or on federally funded, federally backed student loans. And so they expand their reach to market their very low-quality programs and bring in low-income students. This is not a way we should be educating our service members and making this is a failure of our promise to them that they're going to get an education in exchange for their military service, and it also does our low-income students, first-time college students, a disservice as well. This is why we need to get rid of the 90-10 loophole. And I've introduced to protect the GI Bill Act to safeguard our student veterans. And we'll continue to keep a close eye to make sure that these veterans get the benefits they need. But also, Congresswoman, I want to thank you because of our partnership on the Education and Labor Committee, we passed out of committee a higher education bill that would also close the loophole. We could take care of it either way. But I want to thank you for standing up for our first-time students and our students that count on the GI Bill as veterans and our low-income students, because we need to rein in the corrupt ways that these bad actors in the for-profit industry operate in higher education.
Yeah, I really appreciate that. Thank you. I think oftentimes people don't recognize, right, that we do have legislation that's visionary, that is doing the work of creating transformative change. We also have legislation that deals with correcting a systematic problem that exists. But most of the legislation that we work on is trying to close some of these loopholes that are part of the systems that currently are getting funded, that create an opportunity for people to be exploited and for people not to fully access the services that they are supposed to. And so I really do appreciate you breaking down what the 90-10 loophole is and how the for-profit colleges have exploited veterans and how we are doing everything that we can to try to close that loophole. I know one of the biggest veteran healthcare issues is toxic exposure. What do you think we need to make sure that veterans get the service that they need, those that have served in Afghanistan, Iraq, and elsewhere who have been exposed to burn
pits? First of all, before I talk about burn pits, and I will get to that, I want to just remind your constituents that you helped, your vote helped pass the Blue Water Navy Vietnam Veterans Act last year. It was a huge win. What that act did was it recognized the veterans on Navy ships who served during the Vietnam War as having been exposed to the toxic Agent Orange. It took them 40 years to get this recognized by the VA and in law. And it's a big victory, and so many of your Vietnam War veterans in your district are going to benefit from this happening. But I just want to say we cannot allow our post 9/11 veterans to go through The same thing our Vietnam War veterans went through, who served on naval ships. That's why we call it the Blue Water Navy Vietnam Veterans Act. We need to make sure we address toxic exposure of our post 9/11 veterans much sooner. And there are other veterans besides our 9/11 veterans. There are other veterans, believe it or not, that have been exposed to, nuclear waste. They've been exposed at various, bases in our country. We simply need to know more also about toxic exposure in general. We need to learn more about burn pits and how exactly exposure to those burn pits has put our service members at risk for certain ailments. We've seen a recent study. I think it was by I can't remember if it was the GAO, but the study concluded that there were definitely adverse effects, but actually linking them to actual symptoms and conditions, that hasn't been done yet. We know it's bad. It's just a question of how bad and what the long-term implications are. The subcommittee on disability assistance and memorial affairs actually has a hearing this Wednesday to better understand where the scientific research stands right now. And we're also going to learn what the VA's viewpoint is. So we'll learn more about that. I believe that we need to take a comprehensive approach to this issue. We're going to need the Department of Defense to implement a lot of new ways of tracking where our service members have been, what they've been exposed to, and it's going to be costly, no doubt about it. But we owe this to our service members who put themselves at risk, and we need to address this and build the political will to make sure that we take care of all of our service members who've been exposed to toxic substances.
Yes, we do. And I know that we've all been really active in addressing issues related to toxic exposure. I alone have co-sponsored at least 8 pieces of legislation. And I know that you, as the chair of Veteran Affairs, is doing more. And so I know that there is a concentrated effort in the 116th Congress to really target the issues of toxic exposure and figure out a way to deal and create solutions for our veterans who have been exposed to toxic. And I know that as a former union member and someone who has benefited from bargaining rights, I was very proud to co-sponsor your bill, the Veteran Employment Fairness Act. Can you talk a little bit about why that is so important for veteran employees to have collective bargaining rights and how it will improve services for our veterans?
Well, Congressman, I, like you, am a former union member. I was a member of the California Teachers Association. My father was a member of the Retail Clerks, which was the precursor to the United Food and Commercial Workers, and it was the basis of my health care as a child. Was my father's health benefit through the Retail Clerks Union. So I know also firsthand the power of unions and the power of collective bargaining. So I was very proud to co-sponsor your bill, the VA Employees Fairness Act. Oh, actually, that's what. Actually, it's my bill.
It's your
bill. I know you were proud to sponsor my bill. Okay. So, well, thank you. Thank you for sponsoring my bill, Congresswoman. Veterans, are provided the best quality and timely care when the VA workforce can thrive, when we empower that workforce. I'm sorry to say that one of the other ways this VA administration can improve is to ease off of their hostility to unions. They've gone after unions at the VA. They've eliminated what's called official time. They've made it very difficult for them to meet, and they've taken away a lot of their kind of VA union spaces. Currently, VA employees have collective bargaining, but healthcare providers are exempted from the collective bargaining process. Prior to COVID-19 pandemic, there were more than 50,000 employee vacancies in VHA alone. That's huge. The VA has told me that they are making progress in terms of filling those vacancies during the pandemic, that they're using emergency hiring authority, but they haven't really documented and quantified how many of those positions that they're filling are going to be lasting, that they're going to not just temporary hires, that we're going to see the doctors, nurses, and other medical professionals that the VA needs. But I also believe that part of what's going to be able to recruit the best talent are fair working conditions and the ability for all employees to be able to collectively bargain. And I think that's a plus for prospective healthcare workers, is to know that they're going to be able to be included in collective bargaining.
I know we will soon transition to taking some direct questions from our the audience, the people who've joined us in this conversation. We've gotten a lot of questions as we were prepping for this, and a lot of that has been incorporated into some of the discussions we've been having so far. But I certainly can't transition without talking about the issues that are faced specifically by women veterans, and what we can do as lawmakers to ensure their needs are being addressed.
Well, look, as I mentioned before, there are more than 2 million women veterans. That's one of the reasons why we've created the Women Veterans Task Force in this Congress. That we actually formally have to take a vote on that task force. It's led by Congresswoman Julia Brownley, and we wanted to ensure that women veterans have access to care, benefits, and the resources they've earned. The other reason is that, as I've also said, we know that 15 to 20% of our current members that are serving in the military now, whether it's in the reserves or it's active duty, are female, and they're going to add to that 2 million women veteran community. I am proud to say that one of the results of the Women Veterans Task Force is they spent hours in roundtables and hearings and gathering information about why women don't access their benefits at the same rate as men, what women experience when they go to medical centers. I can't tell you enough about, whenever I mention the Women's Veterans Task Force, women veterans always step forward and they tell me, how can I get involved? Who would I need to talk to? Because they have so much that they have to say. They've never been really asked in a formal way with a formal task force created by Congress to ask these questions about how we can serve women veterans better. One of the results is that there was a collection of bills that were put together, and the House passed those bills under a bill titled entitled the Deborah Sampson Act. We passed it in this Congress. It's the most comprehensive package for women veterans in over a decade. But there's really, a lot more work to do in this regard. One of the biggest issues facing women veterans is sexual harassment and assault at VA facilities. I'm working with the task force to make sure that VA finally implements mandatory bystander intervention training for all VA staff. All women deserve to feel safe while accessing VA care, and we need to commit ourselves. The VA, we need to be committed in the Congress, at the VA. I know that Americans, whether they are male or female, demand that the VA change its culture. It's a very male-centric culture at the VA, and that culture needs to change. And women need to feel safe and welcome at our VA facilities. Period.
Mm-hmm. And I know that Congresswoman Julia Browley, who chairs the task force you were talking about, also does a lot of work in regards to care for veterans. She's the lead author of the Homeless Veterans Act, and it's also the lead on the Veterans Unemployment Act as well. So thank you for bringing her name up so that we could honor her work on in regards to veterans issues. Now we will spend the rest of the time answering some of the questions that have come in as we have logged on this evening. But before we do that, I would like to introduce Neil Doyle, who is the Director of Veteran Services for Hennepin County, who's here to answer some of the general and technical questions we have received. Neil, would you like to introduce yourself and tell us some of the work that you do and your office does?
Sure, greetings. Neil Doyle, I'm the Director of the Hennepin County Veteran Service Office. I've been working with veterans for about 15 years in various capacities with the State Department of Veterans Affairs, Olmsted County, and most recently Hennepin County. We assist veterans with all federal and state and nonprofit assistance benefits here in Minnesota. Some of the federal ones include a lot of the topics that we've discussed tonight already: service-connected disability compensation benefits, pension benefits, education, home loan guarantee, insurance programs, burial, financial assistance, benefits for female veterans, benefits for veterans that need mental health care, you name it. There's a lot available for veterans here in Minnesota and throughout the country.
Thank you, Neil. So one of the questions, Representative Takano, that has come in, it's veteran homelessness has become a serious issue in our country. What bills or work have you done to make sure it ends? I know that I have co-sponsored the Homeless Veteran Families Act, and I've also introduced the Homes for All Act, because we all believe that housing is a human right and every American deserves to have access to a safe and stable place to live, especially our veterans. I also know that your former colleague, Chairman Takano, our governor, Tim Walz, has been very vocal in making Minnesota the fourth state to end veteran homelessness and has been working diligently to do so. What are some things that you've worked on, Chairman?
Well, Congresswoman, I just want to say, first of all, that a tremendous amount of progress was made during the administration of President Obama and under Secretary Shinseki. They actually set a national objective to eliminate veteran homelessness. And tremendous progress has been made all over the country. And there are certain states where veteran homelessness remains a persistently high problem, namely in the state of California. Um, but even within my own county, we have made an effort in Riverside County, which is where my congressional district is in California. They have achieved what's known as functional zero, which means that homelessness is not persistent and it's very short-lived. And I assume that's what is meant by ending homelessness among veterans in Minnesota, because it's certainly, we've made headway, tremendous headway, but there's still so much more work to do, and we have passed. What we're at risk for now are people losing their homes, veterans at risk for homelessness because of increased unemployment, because of the economic stressors that come with this pandemic. So that's why when our committee, we held our first hearing after the pandemic began, and was focused also on ending and preventing homelessness. So along with Representative Levin's, I'm talking about Mike Levin's Homeless Veteran Coronavirus Act, we've also included key provisions in the HEROES Act to provide transportation and purchase food, shelter, phones, clothing, blankets, and toiletry items for homeless veterans. We also authorize the VA to set up temporary encampments on the grounds of VA medical centers to allow homeless veterans to stay temporarily in VA parking lots. That's often like the first step in terms of trying to connect them to services in the VA. There's not always straight paths. We have to build that trust with a lot of these veterans. But in Los Angeles, we have a large VA campus where we've actually set up facilities for veterans to camp on within the VA campus there, as a part of our response to the pandemic. This to get them on the campus is a big deal because it allows the VA to connect with them in other ways and to try to get them into programs that will lead to more long-term solutions for them. But just know that the good news is that prior to the pandemic, there was tremendous progress made all over the country. There's certain key parts of our country that continue to experience veteran homelessness. But congratulations on Governor Walz, making such progress in Minnesota. The key is going to be to maintain that functional zero, and we're working on strategies to do that.
Thank you. I know that the pandemic has already exacerbated the housing insecurity that many people were feeling even before the pandemic. And our veterans aren't exempt from that. And I know in the HEROES Act and in the CARES Act, we put specific resources to target veterans, but we also put a lot of resources in trying to make sure that people were housed, that their health care was going to continue, even if it was tied to their employment, and other resources to food pantries and such. But I'm want to ask this one question that just came in for Neil. How is your office working to best assist veterans since this pandemic has started?
So it's been interesting. I would say flexibility and creativity have been key. When COVID-19 hit, we had to social distance as employees just like everybody else. What we've done is innovate technology. Fortunately, at the same period of time, the VA waived requirements of wet signatures on all their applications, and they now accept electronic signature. When that occurred, we've been able to get a lot of our applications signed electronically through email and phone. About 90% of our clientele is now served through electronic means. We do occasionally run into some veterans that have barrier to technology, or maybe they don't have a phone. Our representatives will meet them in their local communities, and while paying attention to the directives by the Center for Disease Control to make sure the veteran's safe and our employee is safe. We've also worked with administration staff and social workers at skilled nursing homes and assisted livings, and as well as family members to get applications submitted. So really, it is creativity and flexibility getting the job done right now.
Yeah, and there are some questions that are coming in, because I think a lot of people are curious on the work that your office is doing, and so a question, just a generic one: what are all the things somebody can go to the Veteran Services Office for, and what can they help them with?
Quite a bit. So as I mentioned before, all federal and state benefits, nonprofit assistance. We actually have a joint powers agreement in effect with the Minnesota State Department of Veterans Affairs that employs an employee full-time that specifically focuses on the homeless veteran registry. And they look at every unique case and identify the barriers that specific veteran has experienced with housing in attempts to house that veteran. There's a lot of COVID-19 assistance grants available through the State Department of Veterans Affairs for any veteran that was financially impacted by Corona-19. Or maybe they have a child that's in distance learning and has to stay in the home, and childcare costs increased for that veteran, or their spouse. There's financial assistance benefits for that available right now through the State Department of Veterans Affairs, to clarify. Disability compensation is a majority of what we do, to include the Blue Waters Act that was previously talked about, all the presumptive disabilities, direct service connection, if they were hurt in training, just to name a few. There's a lot of resources.
And is the Hennepin County Veterans Office taking in-person meetings? If not, how can somebody reach your office if they need support?
Sure. So we have a general intake line as well as a common phone number. If a veteran cannot make it into our office, we will meet them in the community that they live in, while taking safety measures, masking up, hand sanitizer. That's going to get a little more challenging, I think, as the winter comes. Currently, they've been meeting them outside of places, but they will start meeting them at Hennepin sites in our post-COVID plans right now. But if we can't meet them where they're at, I just 99% of them have been served electronically. For those that can't, we'll meet them where they're at, plain and simple, to get what they need.
That's great. I know that if people are not sure what Veterans Office to reach, they can always reach our office, and we will help facilitate that connection and make sure that they are able to get the services that they need. If you also are in need of obtaining your military record, you can reach out to our office and we will help get that for you. Our office can be reached by calling 612-333-8255. 1272, or you can email us at mno5.info@mail.house.gov. And that is true for every congressional office. If you are in need of services or you need to get your medical military record, our offices are at your service. And so don't hesitate to call any of the congressional offices in the district that you live in, and that's the support that they can provide to you. That is one of the services. We are supposed to be the gateway to the federal government for you. And I know that our time is coming to close, and so I wanted to ask Representative Takano, or Chairman Takano, this question. I know the House is scheduled to vote on accepting Senate Bill 785 without amendments this week. If it's implemented as written, this legislation will be detrimental to veterans' health care. Provisions of the bill open mental health treatment to private providers outside of the veterans' community backup system. Private providers will not be held to the same standards as the VA practitioners, and the VA will have no role in overseeing or coordinating care. This will make the VA essentially an insurance company rather than a provider of care. Studies consistently show the VA provides superior care at a lower cost. One of the rationales for this bill is that any veteran, regardless of discharge status, will be eligible for treatment under this Senate bill. The solution to treating more veterans who might have suicidal tendencies are not currently connected with VA healthcare. Is it to invest and expand services provided by the VA in rural areas to veterans?
Well,
It was a long question, but I wanted to honor, our veteran who sent in the question.
Well, I appreciate the question, and I have long opposed privatization. I've been one of the fiercest defenders of the VA against privatization or turn it into what you say is essentially an insurance program. We do have a responsibility to make sure, in Congress, we have a responsibility to make sure that the services offered by any taxpayer-funded program through the VA are of high quality. There will have to be oversight. It is a $170 million program, this provision, which allows the VA secretary to make grants to organizations, nonprofit organizations. And the questioner is correct that there could be in some cases the ability to that these organizations could use this funding to offer mental health services. Look, there was the give and take of the legislation. I can just say that we're going to have to do a lot of oversight. There's a maximum grant per organization of $750,000. So there is a cap and a limit on, and this was not specifically to fund mental health care services. Now, this idea that regardless of discharge status was the reason why the Republicans wanted this in the bill, I'm happy to say that the Compact Act, which I introduced, which I'm hopeful will also become law as per the agreement that I made with the Senate Republicans, is the Compact Act will basically allow anybody, regardless of most discharge statuses. I wanted all discharge statuses in the bill, But the very justification for this provision in 785, one of the key justifications was, regardless of discharge status, veterans should be able to get mental health care. Well, you heard earlier in this presentation that what my Compact Act would do is allow any veteran to call just about any veteran. We were not able to get agreement on dishonorable discharges, which constitute less than 1% of the discharges in the military. So 99% of veterans under the Compact Act will be able to call the VA and get emergency care, which is what 785 attempts to address in a more roundabout way. Frankly, 785 provisions will not be necessary in 99.9% of the cases. I can tell you as chairman of the VA Veterans Affairs Committee that I'll be watching this program very carefully for any abuses. And I will be ensuring that any mental health care is not substandard, and that we will be watching carefully for any aggressive abuses or any abuses, period, by the Secretary of the VA. And I believe that under a different administration, we will have less to worry about abuses under 785. With the remaining few months of this administration, I'll be watching very carefully. And it's my hope that there'll be a different administration so that we can definitely check any abuses under this provision.
Thank you, Chairman Takano, and thank you to Neil Doyle for joining us tonight. And thanks to each one of you for joining us as well. We hope that you have some tools in as part of this conversation that was provided to you in getting resources through our office or directly with Hennepin County or other county offices that deal with veteran issues, and that you are able to directly access those resources. We are also going to continue, as the chairman said, actively legislating on behalf of veterans in our community, whether it is access to higher education, access to home when it comes to ending homelessness for veterans, whether it is in addressing the issues of toxic exposures, dealing with veteran unemployment, or getting rights for VA employees, their ability to collectively bargain, or as the chairman was lastly discussing, talking about what it means for us to include veterans who have been dishonorably discharged into getting services as well. I know that I am part of a group of folks who have co-sponsored legislation to include our veterans who have been discharged because of their LGBTQ status and the likes. And so we'll continue to do the work in making sure that veterans have access to the services that were promised to them as part of their service to their country. And we'll continue to work with you all in trying to make sure that the system is equitable and just for everyone. So thank you again for joining us and look forward to our next discussion.